8:13. I want to thank Shanika, my go-to pharmacist at CVS yesterday, for giving me my COVID, my flu shot a little bit late, and a tetanus shot. I don't know if it was cause and effect or not, but I spent the day sleeping in bed. Maybe it was because of the shot. Maybe I was just tired. Maybe I'm just lazy. Either way, I feel great today, and it is winter, which means colder weather, earlier sunsets, and cozier evenings. But winter also brings a rise in certain illnesses, including the flu and COVID-19. Dr. Brent Wallis joins us now, our friend, Chief Medical Officer of People's Health, to talk about some simple ways to protect yourself and others during this time of year. How you doing, Dr. B?
Hey, Tommy, I'm doing good. How about you?
I'm okay. My arm's a little bit sore, but other than that, I feel great.
Good. I'm glad you got it done.
Is it normal to get a little sleepy or something after? Because, dogs get sleepy after they get shots. I know it's different shots, but is that normal, or am I talking myself into spending all day in bed?
No, well, it could be a little of both, but no, you're absolutely correct. Very often when you get a vaccine, it'll actually cause a reaction because your body's creating all of those antibodies that are protective for you. And so, yeah, you can feel a little bit tired and need a little bit of rest, but usually after a day, everything's back to normal.
Feel great. And let me tell you, every now and then, there's nothing wrong with spending a day in bed, sleeping, catching up. Tell me about what kind of illnesses, Doc, are more common in winter.
Yeah, so really in the winter time, the majority of what we see are respiratory illnesses. So that's anything that affects your lungs or your airways. And there's a lot of reasons for this, but in particular, we tend to spend a little bit more time indoors during this time of the year. So it's easy for germs to spread from person to person. And then, we haven't had this lately, but it is a little cooler today, and that cold, dry air actually can weaken your immune system and actually your body's defenses against those respiratory illnesses. So it can make it a little bit harder to fight them off.
What are some examples of respiratory illnesses?
Yeah, the biggest ones we see, pneumonia, which can be very severe, bronchitis is very common. We are seeing a lot of RSV right now, or respiratory syncytial virus, and then really the common cold. Those are all respiratory illnesses. And like you were just saying, the two really big ones we're seeing right now are the flu and COVID-19. And the part that's a little difficult about these is they all have common symptoms. People usually will have things like coughing or sneezing, maybe even a fever. And so it can make it real tricky to tell those different ones apart and figure out what you have going on.
Let's talk about the two themselves, COVID-19 and flu, the common winter illnesses. How do they spread?
Yeah, so both of those illnesses are caused by viruses that spread through what we call personal contact. And so what that means is when a person who's infected either coughs or sneezes or even talks, little tiny droplets can spray into the air, and those droplets then can be inhaled by someone who is close by, or they can often land directly in the mouth and nose of somebody who's close by. These viruses, too, can live, for a period of time on certain surfaces as well. They can attach to railings or doorknobs, and it's less common, but you could actually become infected by, for example, touching a surface or a doorknob that has the virus on it and then rubbing your face, because you're actually introducing the virus right into your body.
Yeah, I just got to say that years ago, even before COVID, I think it was you that told me about, keeping your hands out of your face. And since I've done that, I don't think I've had a cold. It's amazing. It all comes from your hands, accurate, or most of it?
Yeah, absolutely it does. That's usually how we transmit things around.
Which brings us to how you can protect yourself from getting sick.
Exactly. And this is really critical, but good hygiene goes a really long way when you're trying to avoid all of these illnesses. Things like the flu and COVID-19, all of these things can be passed relatively easily. And so washing your hands is absolutely critical. And you've got to use soap and water when you do that. And then you want to scrub for at least 20 seconds. So a little trick you can do is, like, in your head, sing the happy birthday song. That's about 20 seconds. And as long as you do that, you're going to wash your hands enough. If you don't have access to soap and water, you can use those alcohol-based hand sanitizers. And most of them have 60% alcohol or more. That's what you need to actually kill the germs. And then something, I tell people all the time, please, if you're going to cough or sneeze out in public, cover your mouth. either use a tissue or you can even do it into the inside of your elbow. And then after you do that, you really want to wash your hands right away, too, so you're not spreading those germs around. And then it can help as well to clean those high-touch surfaces, things like light switches and countertops and doorknobs, because you want to make sure you eliminate any opportunity that things are going to adhere there and then be passed around.
Let's talk about vaccines and how they work.
Yeah, definitely.
Oh, wait, I'm jumping ahead of myself here, Doctor. I'm sorry. I have a lot of questions for you. And we were talking about washing your hands often. And when you're talking about singing happy birthday, that'd be like 20 seconds or something?
Yeah, about 20 seconds. So it's just a little trick you can do to make sure you're not, I see some people, they'll just kind of wet their hands and they're done. They're out the door. And you really do need to wash for a little bit longer to kill off all of those germs.
And what else can we do?
Yeah, another thing you can do during this time of year is, especially if you're susceptible to a lot of these illnesses, if you've got other things going on like diabetes or heart disease, you want to try to stay away from really crowded indoor spaces. You want to keep distance from other people because these are going around, and the closer you are to people in more confined spaces, you're more likely to pick something up. And, people can still wear face masks. I actually see people occasionally do this, and face masks do actually prevent the spread of most respiratory illnesses. And then a really, really critical one, and people don't do this all the time, but if you feel sick, stay home. Don't go into work, don't go grocery shopping, because if you're actually sick, you're out there and you're actually spreading that illness around. You want to reach out to your doctor, talk to them about your symptoms, and ask maybe if you should be tested for a certain illness. We've got really quick and easy tests that can tell you what you have, and then you'll know how long you're going to be contagious and how long you need to be careful.
All right, let's take a break. We come back, we're going to talk about protecting yourself from the flu and COVID-19, which brings us to vaccines. We talked with Mike Stern earlier about vaccinating animals when it comes to the bird flu and keeping the food supply safe. Unfortunately, science turned political. That's not good, but we'll address it with Dr. B when we come back, Chief Medical Officer of People's Health. I got vaccinated yesterday, feeling great today. 8:20, traffic now, WWL. 8:25, Tommy Tucker, WWL. Anxious to get back to Dr. Brent Wallis, Chief Medical Officer of People's Health, talking about staying healthy during this time of year. Doc, best way to protect yourself from the flu and COVID-19?
Yeah, well, you just did it yesterday. Getting vaccinated is the absolute best way to protect from these respiratory illnesses. And, flu shots and COVID-19 vaccines are really proven to greatly reduce your chance of getting sick. And if you do contract one of the illnesses, it typically is much less severe than it would be had you not had the shot. And really, most adults, almost all adults, should have a yearly flu shot. And at least one dose of the updated COVID-19 vaccine. But you want to talk to your doctor about what is individual for you and what they think you need to get.
Tell me how vaccines work, please.
Yeah, the way you think about it, the vaccines are kind of like a trial run or a practice for your immune system. They're typically made from either inactivated pieces of a virus or just a protein that looks like the virus. And so when you're injected with it, it tricks your immune system into thinking you got the infection. So it kicks into high gear and starts producing all of those antibodies that are going to protect you when you do possibly get exposed to the actual illness. And it really protects you from all of these viruses over time.
For those that know, no explanation is needed. For those that don't, maybe no explanation will suffice. But there are a lot of myths about vaccines. Let's talk about the three big ones. And I would ask the audience, please just open your mind. Go ahead, Doc.
Yeah, and I hear this all the time, but, vaccines are absolutely safe. Anyone who says they're not is not looking at 50 years of research that's gone on. Hundreds of millions of Americans have safely received things like the flu shot, year after year, and the research continues to show that not only are they safe, but they're extremely effective as well. And COVID-19 in particular, a lot of talk around that one, but it actually went through the most intensive safety analysis in the U.S.'s history. And there are ongoing monitoring policies that are in place. So anytime somebody does have a reaction to a vaccine, we as physicians actually are required to report that, and that is logged, and that actually creates even more research to see if there are any safety issues. So if you're hesitant about getting any of the vaccines, please talk to your doctor. Don't Google it.
And I mentioned sleeping all day yesterday, but I get up at 3, so that could be part of the reason. But why do people sometimes feel sick or tired after having a vaccine?
Yeah, it's very common, like we were saying, to have those side effects after a vaccine. Soreness in the arm is probably the most common one, but even something like a low-grade fever can happen, and that's good. It means the vaccine's working. It means your body is ramping up, and it's creating those antibodies so that it can protect you from the illness if it does come along.
Myth number 2, you don't need to be revaccinated every year.
Yeah, and really for a lot of vaccines, in particular flu and COVID, your immunity can lessen over time. It's just a normal part of the process. And so getting another shot every year boosts you. It gives you a little extra boost of protection so you can stay healthy. The other thing a lot of people don't realize is that the viruses change from year to year. And so we reformulate the flu and the COVID vaccine annually based on what we're seeing going on in the community and the changes happening in the virus. So you want to get boosted so you've got protection against whatever is floating around that year.
Sometimes people think that healthy people don't need to be vaccinated.
Yeah, and that's another problem. Healthy people absolutely do need to be vaccinated because they can get the illness too. And in fact, actually this year we've had over 300,000 hospitalizations from the flu alone. And people get admitted to the hospital, they can develop other complications, and it can be really bad even if you don't have those high-risk complications. And then the other thing to keep in mind is, be a good neighbor. Keep in mind that if you get vaccinated, you're less likely to get the disease, and then you're less likely to spread it. So you're going to protect all of your loved ones around you who might be more vulnerable because of diseases like diabetes and heart disease.
Doc, how long did it take you to get through medical school?
It feels like 20 years.
No, but really, how long?
It was, with all my training and everything, it was about 10 years.
10 years, okay. And how long have you been practicing medicine?
Almost 25.
25. So I guess I couldn't accomplish the same thing by going to Google and finding something in 30 seconds?
I hope not. No, it does take a lot of education and a lot of experience to understand all of this stuff.
I think I made my point. Thank you, Doc. Dr. B,
Thanks,
Chief
Tommy.
Medical Officer of People's Health. You can always find out more about People's Health by going to peopleshealth.com. You can call them at 1-800-978-9765. You can always visit the People's Health Medicare Center, 3017 Vets, right next to Party City. We'll take a break, come back. We're going to talk to Chef Jean-Luc Albon. We'll remember Tom Fitzmaurice briefly, and then we'll talk about Louisiana's economy and the mental health crisis. A lot coming up. Stay with us. Tommy Tucker, WWL.